Hi, my name is Sophia Dureg, and I've recently had the opportunity to research under the University of Massachusetts Amherst Sophomore SURF program. This program delves into the science-informed public policy in the world of health and nutrition with an additional service learning component. I chose to research federal food access programs and the related response to the COVID-19 pandemic, which led me to zero in on the Supplemental Nutrition Assistance Program. Seeing how the pandemic affected those around the world, I began with putting food insecurity into a national perspective and began with a simple statistic. Food insecurity jumped from 11 to 15% nationwide, with increases up to 18% with households with children. This increase called for the government to action, to make change, and to assist via federal food access programs. The following modifications, extensions, or fortifications towards SNAP aided a large portion of the population, but there are still opportunities for others to continue to struggle with food security. I had a few bases to guide my research and frequently refer back to. Questions such as how or if modifications were increasing access and reducing costs monthly, or were efforts comprehensive across the nation, and what could be an obstacle in the foreseeable future in regards to SNAP and the COVID-19 pandemic. After reading countless journals and press releases from the USDA, I was able to piece together and understand the outcome following the pandemic for the SNAP program. The SNAP online purchasing pilot, introduced for people to redeem their SNAP benefits online and for safe shopping, paved the way for an increase to access for participants. It was effective and timely, while additionally providing a safe environment for those who may have not been able to redeem their SNAP benefits in person. Displayed in the graph, this jump occurred only in a couple months during the earlier months of the pandemic. For the duration of my initial research, I had documented the shortcomings of the SNAP access program contributed by the outdated nature of the Thrifty Food Plan. This still continues to provide the nutritional and market basket basis for the SNAP program, and consequently, this basis is also used to determine the monthly allotments to this day. A recent and historical change occurred to the Thrifty Food Plan, which modernized the nutritional and market basket basis to reflect the true cost of a healthy diet. While the Thrifty Food Plan receives revisions often, this modernization is increasingly significant, as the plan has only received updates to adjust for inflation. No change other than inflation adjustments has been made since 1970, or close to when it was originally created. Due to this, there was an increase to the monthly allotments on top of an increase from Congress at the beginning of 2021 as part of pandemic relief funds. When conducting this research, it became clear that there were clear strengths with utilizing federal data and journals, as there are already a large population sizes for the study that I utilized, and a useful mix of quantitative and qualitative data. On the other hand, many of the resources contained limited information on household demographics and population-specific data, but an overall discussion point for SNAP and related response to the COVID-19 pandemic was the level or scale of change that was observed in the following months of the pandemic, up until the present day. Increases to allotments were provided by historical revisions to the Thrifty Food Plan and from relief efforts of the government. Increases to nutritional quality of the foods was also included with SNAP eligibility, and those were seen following the pandemic. These increases to accessibility were able to close important gaps for vulnerable populations. But as for what the future holds, digital accessibility may be where to turn to when looking for improvements for food security outreach. When researching online consumerism within the SNAP online purchasing pilot, I noticed that there were some opportunities for exclusion via targeted exclusionary marketing tactics and data collection, as well as the storage of personal data. True privacy intentions are hidden behind dense and unreadable privacy policies within the pilot, and personal data is also collected and stored from consumers. This data can and has been used to advertise towards certain demographics and allow for a repeating cycle of exclusion within the pilot program. This can, and we have seen the effects of this with how it differentiates when people are buying groceries based on who or where they may be. The SNAP online purchasing pilot is proving to be an important asset to increasing accessibility, especially during the pandemic. But steps to ensure that the pilot is a safe, environment to redeem SNAP benefits is a must. Increases to accessibility and affordability of food have seen some historic changes, but it is now more than ever that progress must be maintained and will hopefully continue in a positive and forward direction. I'd like to thank you for listening, and I hope you'd gain some insight into what has been and what can be done for federal security outreach. Thank you.